Remember to subscribe and hit the bell icon to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 26. You haven't met baby yet, but they're taking over your life. They're interfering with your sleep, messing with your memory, and even giving you a stress headache. Whether time has been flying by or crawling due to nausea or anxiety issues, you'll be happy to know that the third and last leg of this journey has almost begun. Your baby's development at 26 weeks. At 26 weeks, your baby is about the size of a zucchini. At 26 weeks, your baby's lungs are hard at work, getting ready to take those first breaths once he's born. By now, your baby's sucking reflex is so strong that if his hand floats by his face, he might suck on his thumb or fingers. Ultrasounds often show babies sucking their thumbs. Your baby's skin is starting to take on a reddish color, though it's still slightly translucent. Hair continues to grow on his head, and eyelashes are also starting to sprout. Baby's blood vessels are fully functioning, her heart is pumping blood, the circulatory system is now fully functional. Your baby has grown all of the blood vessels, and they are now performing their role. If you're having a boy, his testicles have begun to descend into his scrotum, a trip that will take about 2 to 3 months. 26 weeks pregnant symptoms. As you near the end of your second trimester, you may still be feeling pretty good. But you may also be experiencing common symptoms like Braxton Hicks contractions, nasal stuffiness, leg cramps, mild swelling of your ankles, or back pain. Other symptoms that can begin are insomnia. The closer you get to your due date, the tougher it might be to get some rest. Between heartburn and leg cramps, bathroom runs, and that big belly, it's no wonder your body's having trouble calming down and drifting off. But there are lots of tactics to try that should help keep you in bed instead of pacing the floor, including daytime exercise, a daily dose of fresh air, and limiting fluids before you hit the hay. Stress and anxiety. Stress and anxiety can crop up during your pregnancy as you start preparing for your baby's arrival, and it's normal to feel a bit anxious about the life changes that lie ahead. If you have a history of depression, or if you find yourself more worried or anxious than usual, talk to your healthcare provider about stress during pregnancy. Keeping up a moderate exercise routine can also help you manage stress, as can getting together with friends. Give yourself a break from time to time, too, and remember that you're not alone. Urinary tract infections. During pregnancy, these infections are not uncommon, as bacteria can sometimes make its way into the body through the urethra. Urinary tract infections can lead to more serious bladder or kidney infections if not treated, so let your healthcare provider know right away if you experience painful urination, a strong urge to urinate, or a fever. Your provider may prescribe antibiotics to clear up the infection. Pregnancy brain. Is it getting tricky to remember stuff? That may be a physiological symptom of hormone fluctuations, but it also might be because, well, you've got quite a bit on your mind. Pregnancy checklist at 26 weeks pregnant. Interview potential pediatricians, find out which local doctors are covered by your insurance, and seek recommendations. Start looking for information on breastfeeding classes and lactation consultants. Take the glucose screening test. Organize a baby moon if possible. Take an in-person or virtual tour of your maternity ward. This week, your baby continues to grow, and if you could peek inside, you just might see them showing off some of the reflexes they'll display as a newborn. Next week marks the final week of the second trimester, and as you near your third trimester, your focus may begin to shift from pregnancy to labor, and you should start to think about your birth plan. Thank you for watching. Don't forget to subscribe.